and we're going through a transition, but we will get to that in one of our agenda items. But thanks, Louise. That's a very important point. And if you're interested, even ahead of the advert, please contact Matthew and do send in your details so we can reach out at the right time. John, you had a question. No. Okay.
No, I was just actually just going to say, well done again. I mean, it's spectacular the amount that's got done in very trying circumstances. And I was just going to add congratulations, but no question. Thank you.
Okay, thank you, John. I just had I had one or two questions, Matthew. Sorry, regarding the report. I wanted to know. With the promotion of our content, Anna, well done, honestly, with what you've done, around in this and how we've really continued to engage with our communities using this platform. You said that there's still opportunities to do things and engage differently. I was wondering where you'd like to focus and which groups we need to focus on now as we move forward, especially now that we have a better understanding. We've had the results from our very successful survey. Where would we like to focus? Because we can have a digital presence, but unless it's focused and has, creates some impact, what are your thoughts around this? I think you're on the spot. Sorry.
No, it's fine. I'm just wondering how much detail to go before we look at the survey, because I think some of this will be covered then. But I mean, I think it's yeah, absolutely, it's a great point. And the thing that immediately springs to mind, I suppose, is no matter how much we develop our own channels, we're not always going to be the best organisation to do that engagement. We're not always going to have that trust and that credibility and the competency. So, those channels are important because they're, I suppose, in a kind of a broadcast and very general sense, they kind of mean our work is touching more people. That's particularly important given the focus we've placed on information giving and making sure people know where to go to get services in a timely way, how to stay safe during COVID. So I think, as we're doing that work, it's an imperative to grow the platform, because otherwise the information isn't being seen. In terms of I suppose the complexity of a project or focused engagement, I think we'll come onto that in the survey discussion slowly.
Okay, I think it might be helpful perhaps for another report is just to look at the specifics of this the digital information and understanding what are the gaps, which groups do we need to connect with better, and how, because it really is an art, I think, to get that right. But I think, what you've achieved within such a short amount of time, I think it's really have to congratulate you on that. One last question, and this has of course received a huge amount of publicity, which is, our the closure of the Royal Free A&E and UCH. Do we know if there have been any incidences, and have any parents come forward recently around any of their experiences with the way the service has been reconfigured?
No, we haven't. No.
Okay, that's good. I think that means maybe the channels of communication have gone through, and that there's a better awareness, and certainly from us, pushing the system to get the information out in a timely way, that hopefully parents, carers understand and know where they need to get to with this change. Okay, thanks. We'll move on to our Health Champions program, and I would like to welcome Hannah Jones. Hannah, do you want to? I can't see you for some reason.
Maybe here.
There you are. Sorry,
it's always hard, isn't it?
Yeah. Welcome, Hannah. Hannah is the Assistant Public Health Strategist, and will explain. If you want to give a bit of a background, and you're here to talk about the Health Champions program, its aims, and to inform a discussion about the collaborative working that we have with Healthwatch Camden. Thank you for joining us this evening.
Oh, thank you for the introduction. Yeah, it's lovely to meet you all virtually. I'm just going to share my slides with you. Okay. Right. So yeah, my name's Hannah and I'm working for Camden Islington Public Health. And I'm here today to talk about the COVID-19 Health Champion Programme. Just to tell you a little bit about why we felt like we needed this programme, the programme design, perhaps how you can support us with promoting the programme, and where our progress to date. So just to begin with, I'm just going to explain to you why we felt there was a need for this programme. So we've done, sounds like you have as well, we've done extensive resident engagement with our communities, and what we've learned really is there's lots of fear and anxiety and misconceptions about COVID. Lots of people don't understand how it's spread. There's lots of myths, all sorts of things about, for example, the NHS app, that people, if you use the app, the government has access to all your data, all sorts of myths. The awareness and understanding of the key public health guidance is also a bit patchy. This has led to over-compliance and under-compliance with the rules. In general, there's low levels of awareness about test and trace. There is also a lack of trust in government guidance, and we've also found that just sharing information with people is not sufficient. People really need to be able to have the opportunity to converse about it and the opportunity to ask questions. So those are some of the issues that have come out in our research, but there's also been some real positives. For example, the community mobilisation momentum seen throughout COVID has been fantastic. For example, the work done by all the mutual aid groups has been really inspiring. People really listen to their community peers, and there has been huge demand for BCS organisations and volunteers more generally. So with these findings in mind, we conducted a rapid review of what other boroughs were doing, including existing champions models to inform the design of our programme. We were keen to incorporate a training element into the programme, and so decided to build upon an existing and very well evidenced training programme called Making Every Contact Count. This programme is all about teaching trainees behaviour change techniques, which is vital for getting people to follow and understand COVID guidance. So with that in mind, we developed our COVID-19 Health Champion programme. So COVID-19 Health Champions are volunteers who live, work or volunteer in Camden, Islington, and are recruited from a wide range of communities. They're trained to proactively provide accurate information and advice, and to signpost residents to the test and trace system. We keep them up to date on the latest guidance information. We do this through a weekly online drop-in session to provide ongoing support, and it also provides a mechanism for reporting what isn't working about the programme, and it gives champions a chance to let us know what issues are emerging in the community, to give us a chance to respond to that. We also send them a weekly Monday message, which is an e-newsletter, which just covers any changes in the latest guidance, the current COVID picture in Camden, Islington, and also provides signposting to other services and resources. For example, in the last e-newsletter, we had a whole section on social isolation, how to approach those conversations, as that's a key issue that seems to have arisen. We also send regular email updates. So like when we changed the high level alert on Friday, we sent out an email blast so that all our champions could be were aware, which is really great because it means we've got an active and engaged cohort when we quickly need to disseminate new messages and mobilise the community around a new set of behaviours. So I've mentioned the training briefly. So the Make Every Contact Count training, which is what the training is based upon, is about skilling up frontline workers to use their daily conversations with residents to deliver early interventions and prevention. Camden Islington's local programme includes health and the wider determinants of health, such as money worries, finding a job, and concerns about housing. We've been running this programme since 2016, but we felt like we could adapt the programme and sort of the core skills to be more focused on COVID-19 messaging. So it still uses behaviour change techniques so that trainees are better equipped to support community members who are non-compliant with COVID-19 measures. And it also helps them to be effectively dispel misconceptions and myths. Also helps them to understand more about how COVID is spread and risk around COVID. And it also provides champions with the skills to have those conversations about more health and wellbeing topics so that they can signpost residents onto further support and services. Originally, the MEC training was a face-to-face, but we had to adapt and make that virtual. So it's now like a highly interactive practical session delivered over Zoom. There's lots of chance for people to practice their skills. Our trainer is great. You can ask as many questions as you want. It's also accredited by the Royal Society of Public Health, which is really good because everyone gets a certificate at the end. So individuals can sign up directly to this training, or we can also organise bespoke sessions, specific organisations. For example, we recently did a training session with the Met Police. It's really good to do these bespoke sessions because it means that we can come up with like specific scenarios that, for example, the police might come across and how to have those conversations about COVID. So just to talk a little bit about where we are now. So the programme launched sort of officially on the 1st September for 86 champions, 33 in Islington, 40 in Camden, and then 13 who work or volunteer across both boroughs. So our COVID health champions, they work for a range of different organisations, which is really great. As you can see, the majority work for Camden VCS organisations or Camden Council. It'd be really great to promote the programme amongst NHS colleagues, faith organisations, especially in Camden, which would be really great. When we ask champions to register, we ask them which groups of the population they're able to share information with. We do this really to have a better understanding to see whether the COVID messages are reaching lots of different communities. So you can see there is a pretty good spread. It would be really fantastic to be able to boost the number of young people, faith groups, Black, Asian and ethnic minority groups. That would be really great. We are planning to extend the programme to young people so that young people can become champions as well, because who better to advocate to young people than young people themselves. I mentioned the training a little bit already, but so the training, we ask all champions to do it, but everyone can access this training. So the great thing about it is if someone doesn't want to become a champion, they can still do the training. We launched the first session of this adapted Good Conversations in Challenging Times training on 9th September, and it's been really successful. We've heard really great things about it. 159 people have booked through the training and 93 have completed it from a range of different organisations. We think this is really positive that so many frontline workers and volunteers have been trained to go out there and proactively deliver COVID messaging and dispel myths. So we're really pleased about that. So yeah, that's just a summary of the programme, where we are today. And what would be really great is to have your support with promoting the programme through any networks you're involved with, newsletters, bulletins. The programme is obviously open to anyone, but it would be great to target specific key groups such as young people, universities. And yes, so you are very welcome also to sign up to become champions and do the training. There's a registration form. I've included a link there. And also, if you have anything that you'd like to include in our Monday message or come along to our weekly drop-in sessions, you're absolutely more than welcome to do that. And just before I open the floor to questions, I just wanted to flag that that our Camden Islington Public Health team are still providing support. So if you have any issues or inquiries around COVID, you can email our SIPA admin email address. There's lots of information on the council website about coronavirus, and we also have other sort of public health training courses which are free. These are open to anyone. cover a range of topics, including money worries, finding a job, mental health and well-being. I've included a poster which sort of summarises all these training courses. So yeah, please do feel free to go ahead and go onto the Camden website and look at those. But yeah, that's everything from me. I don't know if anyone has any questions.
Great, thank you, Hannah. Would you mind? Are we done with the presentation? Would you mind?
Yes, of course.
Closing that? Thank you. So we can. Thank you for that, Hannah. Okay. What we'll do is, I'm sure there's going to be quite a few questions from the public on this, but we'll wait to the end. We'll quickly ask the trustees if they had any questions, and I'll open it up for our board members first. Robert, John, anyone have any questions?
How are you managing to recruit people at the moment with everybody mostly working remotely? How can we encourage people who we interact with but we don't necessarily see? How are we going to promote this? What would you think would be the most successful way for us to promote it? Because I love the idea of the Monday meetings where you get a short update of anything new that you can pass on. So it's definitely something I'd be interested for myself.
Yeah, that's a really great question. I think what we found most successful is quite targeted promotion. So we have advertised the programme in lots of news bulletins. We've advertised it in our resident magazines in Camden and Islington. But what we find works really well is if there is a specific lead of an organisation that we're aware of, and we let them know about it, and then they can sort of triage it down to the people who work for their organisation. I don't know, my colleague Bal is also on the call, whether she has anything to add to that.
Welcome, Bal.
Hello everybody, yeah, I'm Belle, I'm one of the senior strategists in the public health team. I think, Hannah, you kind of captured most of that, and we're, like Hannah said, that we are doing quite widespread promotion of the programme, but then also doing targeted strategic promotion as well. So we know some of the high risk groups, so like young adults and young people, some of our ethnic and minority communities, so we're doing targeted work around promoting it to them. One of the key things about the programme is that we know people are already providing support to residents. They're already doing that kind of supportive role. So it's about how do we equip them with the right information and the skills to be able to do it much more effectively. So that's the kind of, I suppose, the key kind of aim, really.
Thank you. Yes, go ahead, John.
Sorry, one area that I meant just sort of, because obviously my original links with One Housing. I know that they do quite a lot of training programs and are very keen to get residents, and particularly people with mental health problems, but also the elderly, involved in all these sorts of things. So it would probably be, I mean, I've still got contacts there, and certainly I can give Marta a ring and sort of see if I can get them interested in maybe getting some of their residents to get involved in this. So maybe take it offline, but basically maybe have a conversation with Hannah after this and maybe see if we can connect there.
That sounds really fantastic. Yeah.
Thanks, John.
Thank you.
I had a couple of, Matthew, you had a few.
Just to respond to Hannah's ask in terms of support, so we're very happy to promote the programme. We think it's great, and I think, as we'll be hearing later on, you know, word of mouth and you know, finding out about staying well from family, friends and neighbours is a really key channel for most people. So yeah, I think it's really important work. Thanks for coming tonight. Salona, I'm not sure if Hannah and Bal can stay to the end, so I'm not sure how you wanted to handle any more.
Okay, so what we'll do is we will open it up to the members to ask questions. Hannah, really interesting presentation. I was wondering what your approach was for disability groups, people with disabilities, because I noticed that that's a core area. You know, that's a group that's often overlooked, and their ability to access information, particularly during COVID, can be quite challenging, and the insights that they have can be very, very valuable. The other group that I was thinking of more specifically are homeless and homelessness presents itself in very different ways. But we know the economic devastation, you know, that COVID has caused, that increasingly more and more people are becoming homeless, especially young people. And do we have, are we working with the right organizations to get the messaging out, especially young people? And the last group is young people in care, that do get moved around, that do go from home to home, that do, you know, that often have a very different, you know, insight. I was talking to someone earlier today who's working with this group, and her insight around, you know, working with kids up to the age of 24 in care, and what they've gone through with COVID and how they're processing information is really astonishing. So just those three areas that I think, Robert, you had a question, and then we can open it up to the public. Yeah.
Yeah. First of all, not really a question, just to thank you very much, Hannah, for a very compelling and detailed presentation, and Mel and Hannah for being with us. We're a non-political organisation, and I'm going to phrase this carefully. Clearly, we've all seen central government's moves to deal with testing, and how the role of local public health has been treated centrally. It's clear that you're doing things, the nature of things, and in a degree and detail, which central government clearly couldn't do. So, as well as thanking you both for your contributions, the question, which I hope is neutral enough, do you feel at this present time you're getting support and encouragement that you need running services locally? That is support and encouragement from the centre?
Thank you. I don't know if you want me to respond or keep taking questions. I'm happy to.
Well, I'm very subject to the chair on this. I'm trying to take a very neutral line. So in a sense, I go through the chair on this. I'm happy to leave the question hanging in the air if you like, if that puts either of you in an embarrassing position. But given the very high importance, the vital nature of the work that you're doing, what I want to do is, and as you may want to come back to Matthew in later days on this, I would like to get some assurance in terms of working out Healthwatch's role to support you, to see that you're getting the kind of support and encouragement from central government, which you need to be able to do your work. I'm going to leave it like that.
Thank you. Thanks.
Al or Hannah, would you like to answer that? And if you don't feel comfortable, really, we don't want to put you on the spot. We're happy to, you know, to take this up later on. But I think there are aspects of that. Just to say that, you know, seeing this type of presentation is an absolute welcome. You know, it really is at the heart of, you know, what residents want to see and be connected with. It's a local conversation, and we as Healthwatch Camden are really interested in supporting you and connecting you to the right groups. Yeah.
Thank you so much. So maybe I'll have a go at answering a couple of those questions first, and then Hannah, you can chip in. So just looking at that second question first from you, Robert, about I suppose some of the challenges that we've been facing I mean, I suppose it's an unprecedented situation, so there would be challenges anyway for any government. But I suppose there have been particular issues with certain parts of the system and the structures put in place around our response to COVID-19 at a national level, and then I suppose how that then filters down to a local level. But I suppose the key thing that I would say is that we're quite lucky here locally that we've got some fantastic organisations. We've got fantastic kind of partnership work going on. We've got a really good, strong system around health and care, I'd say, locally. And I think we've been working together for such a long time that we are able to kind of respond quite quickly as a collaboration rather than as individual bits of the system, and we're able to communicate quite quickly. So I think our strengths locally really helped with our response. And I think, you know, and of course we didn't get everything perfect, probably still lots more to do, and there's lots to learn. I think, you know, we can, when we reflect back on this next year, it'd be really good to think about where we did well and maybe what we could do better. But I think one of the key kind of strengths really about all of our approaches as organisations has been how we really work with our communities, and how it's a lot of the work we're doing has been citizen-led and very much kind of focused on what residents' needs and priorities and concerns are. I think we're lucky in Camden Council with our leader being very much focused around what communities want and what residents want, which has then basically meant that we're able to respond really well to that kind of challenge, really. And just coming on to the point about sort of different communities that have different needs, and yeah, I mean, I think that's one of the sort of key challenges that we need to focus on, and that's what we've been trying to do with the Champions programme, is capitalise on those key organisations and volunteers and community leaders and faith leaders and people who are embedded at a very sort of hyper-local level that work with those particular communities, who know what the needs are and know what support is available locally. I mean, again, you know, I'd say we are a fantastic borough. We do have lots available locally. We've got lots of fantastic services, lots of VCS organisations. So it's about tapping into those resources. And one of the things, I suppose, around the COVID-19 Health Champions programme is that they can't carry around a whole list of, you know, directory of services in their heads. But what this training does is about equipping them with the right kind of skills and information to be able to signpost people quite effectively to sort of the sort of umbrella kind of services, which then gets them into the right bits of the system, and also kind of helps them sort of know where to get information quickly. So it's about that skill of how identifying when someone might have a need and where to then be able to get that support. So yeah, it is much more than just, you know, kind of giving information. It's about being able to support people's kind of wider needs, and it's not just focusing on the health impact of COVID-19. It's looking at the wider impact. You know, it is impacting on people economically, their employment, their housing, and their mental health. So it's looking at the wider kind of holistic impacts of COVID-19.
Thank you.
I don't know if that answers your questions.
Yes, what I'd like to do, as I'm just aware of the time, is I'd like to open it up to the public, because I know that you may not be here till the end. So if there's any members of the public that would like to ask a question for Hannah and Bal on the Health Champions programme. No? Okay. If anything does come to mind, and if you'd like more information, please don't hesitate to get in touch. You have our details. Do email us, and we will be more than happy to put you in touch with Hannah. Nim, you have a question. Do you want to put yourself off mute, Nim?
I'm trying to do that.
Oh, thank you. There you go. We can hear you now. No, we can't hear you, Nim. We can't hear you.
Hi, there we are, finally. Sorry, it just wouldn't work. Apologies. Yeah, I have a query. I mean, how do you monitor the effectiveness of your work? You've got numbers up there about how many people you've trained, but you must forgive me for being a bit skeptical and a bit of a cynic about these things, having been, you know, around marketing and research and training a lot in the past. You know, you can train hundreds of people, but you don't know how effective they're being. And what criteria do you have to monitor how effective your work is? You know, it's great that you're doing it, but I wonder what tools you have to follow that through.
Thank you, Nim, and that's a really important question. And it's one of those challenges we have with lots of public health programs. It's very hard to be able to monitor impact that you're having, especially if it's a preventative program. And this kind of program, you can't really use hard numbers. We don't want our champions to go around and make a record of all the people they're kind of giving information to, all the people they're helping. I suppose it's around that soft intelligence. Having that ongoing dialogue with our champions where they can tell us about what activities they've been doing. And when they tell us about, I came across this resident, they had this problem and I was able to help them this way. So building up those kind of case studies, I think, is really helpful. But also we did an evaluation of our Making Every Contact Count programme back in 2018. I can share that evaluation if that would be helpful, but it showed some really interesting findings. So we spoke to all our people who had been trained, and they after 3 months and after 6 months, about still 80% of people felt that they had the skills to be able to support residents, and were still retained the knowledge and still retained the ability to be able to identify when someone might have a particular problem and know how to be able to find a solution. So I think it is a challenge to be able to monitor impact, but I think it's about using evidence-based approaches, and when we know certain things have been evaluated and there is strong evidence for that, trying to implement that really.
Are there any other questions? Thank you for that, Al, and Nim, for that question. Any other questions? Okay, thank you so much for joining us. But I just wanted to say that, the fact that you've got over 100 volunteers, that itself is an impact. That itself is something very positive. The contribution that our own residents can make towards, such an important conversation, and to be able to connect with their own community members is something that, we need to acknowledge during this time where it's vital that we are reaching the right, groups. So I think that's a really positive, and we'd love to hear more about this. And perhaps we can, do a blog piece on this, if that's possible, so we can, so more people are aware of this work. I'm sure Matthew will be in touch. But thank you for joining us this evening, and please stay on if you'd like to. And we'll now move on to our next item, which is our COVID-19 survey findings. And we've been waiting for this report. And Anna, if you'd like to go ahead and give us the summary of this and take us through the discussion.
Sure, thank you very much. So I'll just be sharing my screen with some slides to guide us. Okay, can everyone see that okay? Okay, great. So, so this will be just a kind of a hopefully somewhat brief presentation about this big report that we hopefully will be launching in the next few weeks, which we're calling Life in Lockdown, Investigating the Impact of a Pandemic. So again, the purpose of this presentation isn't to take you through each and every single finding, but to really give you an overview of what we did and why, and also some key important or interesting highlights that hopefully will give you a taste of the report, and also encourage you to really read it in its entirety eventually. So back in March, when the whole world kind of flipped upside down, us as a team kind of paused and thought, what can we do right now to really make an impact in this moment? And what do the people of Camden need? And what should we do really? So we decided to launch this COVID-19 survey to provide a channel for people to have a voice about their experiences and life in lockdown. So what did we do? We launched a survey, which was primarily accessed online, but also over the phone, which went from about the beginning of April to the end of July, so over the summer period, which eventually reached almost 1,600 people completed this survey. So this was a really huge collective-wide effort, which I'll get into more towards the end of the presentation. But of course, that success is not just because of Healthwatch Camden, it's because of all of the incredible support we had from many partners and volunteers, etc., to reach that large number. Coinciding with this survey, we also did in-depth interviews for 6 consecutive weeks to gather personal stories from 8 residents. So you'll see these personal stories kind of sprinkled throughout this presentation and also throughout the report. And they also, they're really, really impactful, we think. And if you're interested, the entire case studies, all 8, can be found in the appendix of the report as well. So I'll take you through just some highlights of what we found. Again, this isn't each and every point, but really just some big picture things. The first set of questions that we asked was really about information about COVID-19. So when this first started happening, there was information coming in from every angle. We wanted to understand how are residents coping and understanding what was going on in the world. So we found that all groups most heavily relied on television for COVID-19 information. And that we also discovered that there was an unmet need for information in accessible formats, and that was including other languages, British Sign Language, large print, and easy read. We found that there was actually equal use of WhatsApp groups between younger and older groups alike, which we thought this was interesting because it challenged that preconception that, you know, there's resistance of older residents to communicate via technology, that we found that that wasn't actually the case. And lastly, we found that many people reported finding information about COVID-19 confusing and contradictory, and that people with long-term health conditions or disabilities were more likely to report finding information difficult or very difficult to understand. So we kind of cross-referenced this question by a variety of different groups, but I chose to showcase this figure in terms of the presentation to show that among those who are under 65 compared to those 65 and older, there was a slightly different usage of information channels. I'll just talk you through the figure briefly. So as you can see, the blue is 65 and older. And if you look right at the top there, they really heavily utilized television, newspaper, radio, and friends and family, even more so than those who were under 65. So these could be possibly seen as, you know, the more traditional sources of information. And if you look down towards the bottom of the chart, the under 65s, you can see slightly had more usage of things like social media and as well this online website, the fifth down. So we also cross-referenced this question by ethnic grouping, and I just took a screenshot of just a piece of the chart to show you some of the key differences that we found. Starting from the top, for example, you can see that in the television section, those who identified as Asian, Asian British, or Southeast Asian, nearly 80% used television, and this was much higher than the other groups. And although we don't have too much evidence, hard evidence, we do have some anecdotal stories that this is likely due to the high use of things like Bangladeshi TV and other networks that are in local languages, or native languages, apologies. Something else slightly interesting in this figure, if you look down at WhatsApp groups, there was slightly higher usage of WhatsApp groups among, again, Asian, Asian British, and Black African, Caribbean, Black British groups when compared to white and mixed multiple ethnicity. So again, it was, again, anecdotally, we heard that a lot of people who have family who are overseas heavily rely on WhatsApp groups for information. We did ask people, how easy has it been to understand information and guidance around COVID-19? And it's worth noting that over 50% found it easy or very easy, and only 18% found it difficult. But I wanted to showcase this figure because it's quite interesting that, you know, the majority found it somewhat easy or very easy or neither, but yet over 500 people went on, regardless if they found it easy, difficult, etc. They still went on to provide some qualitative written in answers as to how it could have been made easier. So even those who you know might have had an okay time understanding things, they still even found that it could have been improved. So among those people who provided feedback, 65% said that information was confusing and contradictory, perhaps not so straightforward. And over 1/3 expressed concerns about national government performance. This included mistrust in the intentions, explanations, or regulations. And one quote from a resident said, "Too often the information seemed to be driven by political considerations rather than the health and well-being considerations." Additionally, some people criticized the media and how they were involved in fear-mongering or spreading false news and headlines. This first quote is Someone says, 2 days ago, the media claimed that stomach rash was a new potential symptom. The NHS has neither confirmed nor rejected this. Quick responses to such press claims would be great, because the NHS would be my priority for trustworthy information. There were a lot of mentions of these kind of a desire for really ongoing fact checking of the media. And as mentioned before, 8% reported barriers to accessing information. For example, many mentions that there was no BSL signing at the government daily briefings. So as mentioned, we did the personal stories, which coincide with this survey. And I just wanted to showcase a few here, again, with the caveat that the full case studies can be found in the appendix. But this was a personal stories participant named Harry. Harry was a transgender student living in student halls during lockdown. And Harry said, all the social distancing information assumes you are in a home of your own. There's nothing to advise people like me who are sharing a toilet with 15 others. We're fighting in the student union for more clarity on what the university should be doing for us. It would be nice to have an advice page on a website for students self-isolating in halls. I think that this showcased a very unique experience of someone within Camden in lockdown that, you know, there were all of these nuances of what people were going through, and the advice and information didn't really touch upon many of these, you know, more unique or personal experiences, and left a lot of people feeling very confused. The next set of findings is about health and care services and how those changed amid COVID. The first finding is that the benefits of online and telephone health services were embraced by the majority, yet some reported serious dissatisfaction, including those with complex needs and mental health conditions. Also, many people had routine or long-awaited appointments with the NHS cancelled at the start of lockdown. People reported a subsequent lack of communication, which left many feeling forgotten. And people delayed accessing care they needed for a range of reasons. Of those who didn't access care, over 1 in 5 told us that they didn't need a service. That they needed a service, but their needs could wait. And in addition, despite needing a service, 13% chose not to access one because they feared catching COVID. So as mentioned, the vast majority reported very positive experiences with an online or telephone health and care service. And I think part of this probably had to do with a lot of people just understanding the pressures that the system were under. So there was kind of, at least towards the beginning, you know, a lot of patience and willingness to kind of adapt to what was needed to the moment. This quote is from a personal stories participant, actually Jane, who had multiple long-term and debilitating conditions. She said, my issues are recurring, so it's usually very daunting and physical strain to get to the GP. But this time they did everything over the phone. It was really quite liberating not to have to go in person. It made me feel like I've got a bit of control back over my own care. I wasn't expecting that. I thought this was an interesting quote because it kind of showcased that although Jane and others might have had reservations at the beginning to adapt, she actually was surprised with how it might have worked for her. Of course, there were many negative experiences of remote care, and this did not work for everyone. Precisely 1 in 5 mentioned at least one negative aspect about their remote service. One person mentioned that they were misdiagnosed several times. Some people reported feeling excluded and intimidated by the need to perform tasks online. For example, one person said, I couldn't show the hospital the scans as they were on a disk and I don't have the program to open it. Others with communication support needs found it harder to use some of these technologies. For example, one person said, when I needed to see my GP, I was not able to reach because the notice on the GP door advised me to phone. How do I phone when I am deaf? Here is a personal stories participant, Jamila. So she was a mother taking care of a son with severe disabilities. And I think she also showcased how this type of remote care is not one size fits all, and it did not suit her family, unfortunately. So she said, I've had a bad time. My son is in a bad way. He can't drink, a lot of crying. We haven't slept for 2 nights. Jamila contacted the GP and had a telephone consultation. Normally they would examine him, and it takes 4 people to hold him for a physical examination. So this time it was just guesswork. We also heard about the various concerns people had during lockdown. The first finding was that levels of concern about COVID-19 were high among all people in Camden. However, Asian British, Southeast Asian responders were significantly more worried about catching the virus, and Black African, Black British, Caribbean responders were slightly more worried about catching the virus compared to white counterparts. Also, the Black responders were significantly more concerned about job security compared to white, Asian, and other respondents. People with disabilities were more likely to report concern about being lonely and isolated than the general population. And finally, there were higher levels of concern about COVID-19 among those under 65 than among those 65 and older, across every type of concern other than catching the virus. So I'll show you a figure to go with that statement. You can see the pink is under 65 and the green is 65 and older. And you can see that the pink is actually significantly longer, the under 65s, for every single concern except that top one, fear of contracting the virus. We found this to be really interesting because a lot of the discussion and media and concern were around people shielding and people 65 and older, because of course they were more at risk and dealing with some very unique situation circumstances. But this also showed that those who were under 65 were actually dealing with many concerns that were kind of piling up. And this really leads to one of our key findings on mental health. So something interesting is that we didn't actually ask about mental health in this survey, but we did ask, how has COVID-19 impacted your health and well-being? And people voluntarily brought up mental health almost unanimously. So I think that in itself is a key finding, that that's what was at the top of most people's minds. So 68% of all people reported a deterioration of their mental health, and 88% of 25 to 34-year-olds reported a detrimental impact on mental health. Again, I think that can be kind of related to this figure here of what all of the different concerns that someone in the 25 to 34-year-old age group are dealing with. Of course, many people in all age groups are dealing with these concerns, but also a deterioration in mental health was reported by those who were living with pre-existing mental health issues prior to COVID-19 and those who had no history of mental health problems. Some of these quotes kind of showcase that. So this person says, "For the first time, I'm considering accessing mental health services. I've totally lost motivation to do anything productive." And mental health concerns represented a spectrum spanning from reports of increasing stress and anxiety to more serious issues that warranted specialist intervention. This person said, "I've been feeling down and crying often, mainly because I'm unable to meet family, friends, and colleagues in person for such a long time." So in addition, there were some other impacts on health and well-being in addition to mental health. For example, 17% mentioned the pandemic's impact on their physical health, including weight gain, lack of exercise, difficulty sleeping. And some other mentions on health and well-being were financial concerns and the negative impact of not being able to access health or care services, including dentists. And we did see this got slightly worse later on into the summer, perhaps when people, were a bit fed up or really needed to kind of begin managing their conditions again. So of course, it wasn't all bad news and bad stories. We did hear some really positive things about resiliency and how people were taking care of themselves, taking care of others during this time, and how they were keeping well. I'll let you just maybe look at this figure for just a second, but the most common responses, which, you know, were nearly 60% of people, really were staying in touch with family and friends remotely. And this was followed by exercising more, watching films or streaming services, and exercising indoors. So I think it was really important that staying in touch with friends and family was a huge priority for Camden residents during this time. This is, I think, the last personal story I'll share, but it was a mother named Razia, and she said, I'm feeling really well. I'm trying to look at this in a positive light. Before lockdown, I was so busy, and my husband works as well. It felt like I was in a relay run every single day. Just concentrating on doing the basics, eat, sleep, drink, wash, has made me realize that we've rushed around keeping busy and cause ourselves so much stress. So we thought that was a really nice kind of positive spin on the challenges she obviously was facing. So coming towards kind of the end of our discoveries, as lockdown eased, there were mixed feelings among Camden residents. 4 in 10 felt it was too soon, or that it would trigger a second spike, and many were choosing to continue to self-isolate. 1 in 4 were keen to see lockdown lifted, and a higher percentage of Black African, Caribbean, Black British responders were looking forward to lockdown easing, compared to only 15% of Asian responders. Just some quotes about the views on easing of lockdown. The second one here showcases, you know, I will wait a few more weeks before changing my new habits. So even though the guidelines had changed and people were told that it was safe, there was actually a lot of mistrust where people thought, you know, I'm going to use my best judgment here, and I actually would prefer to stay in lockdown. And this last quote just showcased, you know, the point of view of people who were excited for lockdown to ease. They said, I feel happy. The last 3 months wasn't living, it was surviving. So in the report, you can see kind of all of the in-depth methods section of how we got such a large number of people to answer. But I just wanted to showcase a few highlights here. First of all, just that we had so much help from systems and BCS partners helping to get the survey out. So we really, really appreciated how everyone supported this effort to make sure that nobody was left out and everyone was heard from. We contracted 2 organizations, African Health Forum and King's Cross Brunswick Neighborhood Association, to reach additional residents from Black, Asian, and minority ethnic backgrounds. So we were really proud that our survey demographics nearly quite perfectly represent the breakdown of Camden, and that was thanks to many organizations who helped us. We also developed some non-digital outreach strategies, thanks in particular to the Age UK food parcel deliveries, to reach people who weren't online and offered the survey over the phone. We also had an increased use of social media and e-newsletter channels to promote the survey. We saw some success with the WhatsApp mutual aid groups, which is definitely a method we'll continue using going forward. And as Matthew touched on, we had 12 volunteers help us do outreach, and 4 absolute all-stars, I think 2 are on this call now, helped us with the qualitative analysis, which was just so vital because we didn't have the capacity to analyze so many responses, and the value that they provided was just incredible. Another kind of new method that we tried was that we partnered with 4 GP surgeries and had our survey go out via text messaging to their patient list. This ultimately led us to an extra 908 responses. So we saw that as a huge success and hopefully something we can continue doing going forward. And lastly, that Camden Islington Public Health partnered with us to support this survey and chose not to do a different survey in Camden. So I think that showcased, you know, it was of high enough standard that they wanted to work with us on it, and we're just so glad that we had their support. So Matthew will take us through recommendations and kind of next steps, but I just wanted to pause and see if there were any questions on the content itself first.
Anna, I'm just wondering, to give trustees the moment to gather their thoughts and ask questions, could we just say thank you and hello to the volunteers that were involved? If they're here.
Yes.
they're willing to turn their cameras on.
Let me stop my screen so we can see.
Hi, Julie.
Hi, Will. Hi, Julie.
Thank you so much for your help. It really wouldn't have been possible without you to get it done in this time. So and really important that we've got it done now as well, because I think it's a timely point to be sharing it. So thank you very much for all your support.
Yes, thank you very much.
Thank you.
Great pleasure.
On behalf of the entire board and board of trustees, also we'd like to acknowledge your work and contribution toward this amazing bit of work. Thank you. Robert.
So then, just in case you wonder, I sort of hogging the first spot, but I usually, when it comes up to questions, there's a gap, I fill it, and if I say something that's not very sensible, it gives other people a chance to think up stuff much better than mine. First of all, I would like to thank you, Anna, and all those who contributed to what seems to me a profoundly important and very moving piece of work. And I hope those are elsewhere along the chain. You heard me use the word central government with the last speaker. I hope that there are people who will take notice of it. I think it's fantastic and a piece of work which should be enduring. Well, that's the statement. Not really sort of question. My only particular question where I'm going to volunteer myself is that when Matthew comes to the list of people to whom it's circulated, I spotted the names of a lot of senior partners, not as old as me either, that's not very difficult. But I wonder if you might consider on the circulation picking out younger members of medical practice and other organizations, but particularly GPs, young doctors and nurses to read this, because I think it's such a powerful piece. Couple of other points. Because I've got two screens open, I was having a look at the government legislation website, and there have been over 400 pieces of law since last March. You know, that's the technical legal stuff. I also had a look in relation to that student who said, well, what do? I'm sharing a toilet with 15 people. I had a look at the .gov.uk guidance on residences and halls of residence, and there is nothing I can see in the government guidance about student life before you get COVID. There's quite a bit, a couple of pages of A4 about what to do if you get it, but how you live in student accommodation, well, it may be somewhere else, but it certainly doesn't jump out if you put student and COVID and university hall and .gov.uk. Google doesn't find you anything. So there's just some thoughts, not really questions. I think this is a fantastic piece of work, and I hope Healthwatch England at least are aware of this. And I just want to say I found this very moving, and I congratulate you, Anna, and all of those of you who put it together.
Thank you, Robert. Thank you for that. Matthew, did you want to move on to John? Yes.
Yeah, I'm just looking at the graphs and the figures in terms of the variation in concerns, particularly between younger people and older people. Obviously, everyone's concerned about getting the virus, but there is huge implications, I feel, for a willingness of people to comply with ongoing government restrictions. And I mean, I had a conversation with a friend of mine who basically is in Wales, and she's just going to lockdown, and she's talking about basically having 2 weeks of money left, and then she's going to be starting to get problems with her mortgage and all the rest of it. She's managed to recover some funds in the period of when lockdown was eased, but basically is absolutely terrified by the fact that she's far more frightened of the economic consequences of lockdown than she is about the disease element. And I think this piece of work really should be shared as widely as possible, so that basically the government get a better handle on the potential problems of enforcing lockdown situations if you can't get compliance. And the only way you're going to get compliance is by addressing people's concerns. And this piece of work really does highlight those economic concerns and those mental health concerns that I fear, for economic reasons, financial reasons, is being, I wouldn't say brushed under the carpet, but being given less emphasis than possibly should be the case. So I think this report, I mean, really is staggeringly useful, and I think should be shared as widely as possible. Anyway, just very good piece of work. Thank you.
Paul, Louise, did you want to say anything?
Yeah, I was just thinking, watching Anna's presentation, actually one of the greatest things, because, you know, I think this report is so excellent, but what it's done is, because I work with older people, so I'm very much aware of the effect on the older generation, and I have parents, but what that report's done, or what I've just learned so quickly in such a short space of time, is the overwhelming effect it's had on a younger population. I really had no idea, because for so long, or at least for the last few months, the media has been focused on the reason we're about to have this second wave. We've just had this display of the younger population just totally disregarding all the rules, and they're not affected, so they don't care. But yet that is really powerful information about the effect on every aspect of their life, their concerns for their future, for their working, the feelings of isolation, the struggles with their mental health. It's an incredible piece of work. It really, really is. I've learned something new tonight, just in those few minutes of Anna just going through, just looking at the different effect. And it's just really quite overwhelming, the effect it really has had on the younger population.
Yeah, I would echo Paul's points and John's and Robert's. Well done, Anna. Honestly, you know, for an incredible bit of work. It's not a small amount. I mean, it's taken a lot of hard work and effort, and to the entire team and Matthew, and also the way it's been, you know, put together, the format. It reads really well. It's clear. I love the humanness of it. I really like, you know, the testimonies and the stories. It really hits the right notes. And there's just so much in here that you can go back to and revisit and look at again and again. And the qualitative, you know, information, I'm sure you've done such a great job taking all that data and you know, putting it together in a format that's, you know, easy to read and digest. But I'm sure beneath that there's a lot more. But what does come across here is, you know, something that for me that came across and struck me was, you know, keeping well. 88% of young people identified that they were struggling with their mental health, yet only less than 13% or 10% were accessing virtual mental health services. So what was being said, and you know how, you know, there was a massive gap, and how do you kind of put that together? Similarly, you know, access to food, especially for those that are being shielded. You know that, you know, we have access, we have that data to groups that, you know, that need to be shielded, but how are they getting the immediate support, you know, around access to food and access to, you know, their urgent appointments? Again, there's a real gap. So priority areas here, as you go towards, you know, a second lockdown around, you know, vulnerable groups and shielding, or, you know, focusing priorities around access to, you know, essential services. I think there's a real, you know, recommendations, and there's something, you know, that you could really work towards. And I like the way you've constructed the recommendations, and we'll get to that. But a really powerful, some very, very powerful work here. Well done.
Thank you.
Did we want to, we can go on to the questions from the public after Matthew's finished the recommendations. Is that okay, Nim?
So you got a question from Nim?
Yes. Okay, I'll take Nim's question. Sorry, Matthew. Nim, we can't hear you.
Can you hear me now?
Yes.
Right. No, sorry, it's not a question. I just wanted to apologise. I'm going to have to leave in a moment, and I didn't want to do so without mentioning it. That's all I wanted to say. I thought it was a very well conducted piece of research and very professionally presented. So well done.
Thank you. Thank you for that feedback, Nim, and thank you for joining us this evening. We really appreciate it. Thanks.
Thank you.
Yeah. Matthew, do you want to take us through the recommendations?
I will. And if it's okay, Saloni, could we combine that with the next item, which is the dissemination plan? So,
Matthew, let me know if you'd like me to share my screen at any point with the recommendations.
thank you. Thanks, Alan. So, as with any piece of work that we do, it brings with it, after we've done the engagement work and pulled it together into a report, it brings with it a great responsibility to make sure that those voices are heard and that information is used well. And I suppose within that, we've been formulating various plans, but there's a bit of a kind of sticking point, I think, for us, and it'd be good to sort of share that with the board and discuss the recommendations as they've been presented, and you know, hopefully your views can help inform what we do next with it. Now, in the director's update, I did go into some detail about what we've already been doing. So we have been reporting the emerging findings from the survey. Now, the final report is so much richer, and there's more detail, and there is some really new information there that does need to be shared. But we have been sharing a number of the themes as we've been going along. We've also presented to the Health and Wellbeing Board a number of the emerging themes, and at its first meeting after the COVID lockdown began, we presented right at the start of that meeting what we were hearing about emotional well-being, what we were hearing about concerns among BAME communities, and as a consequence, or as a consequence of the discussions that we've had at the Health and Wellbeing Board, a number of actions have followed. So the board set up a subgroup of the local health and care partnership to look at health literacy and communication with BAME communities, to make sure that messages are reaching those communities, and they know how to stay well. So that's a piece of work that was prompted directly from the discussions we had in the Health and Wellbeing Board. We've also been feeding in the information to Camden Council's inquiry into BAME disparity in outcomes around COVID. And the work was cited in the Building Equal Foundations report and the action plan. Anyway, I won't go on, but we're just to sort of make the point really that we have been doing things with the data and information we've been gathering already. But having 1,600 people respond was never our intention, and it does bring a great responsibility to really make sure that those messages are spread widely. So we have tabled today a dissemination plan to trustees. I'm sure you haven't had a chance to read all of it. And I just wondered whether you could just touch on a few of the key points that are in the plan, and then we'll move on to talking about the recommendations and next steps that we need to agree for the final report.
Sure. So yeah, I mean, it's intended to be really comprehensive, so please take a look at it after the meeting and just let us know if we've missed any sort of gaps. I'm sure we have, but first, I guess it was really kind of created from the survey dissemination plan. So in the same way that I tried to get it to as many people as possible, we're going to return to all of those people who were involved and make sure that they get these results as well. We'll hopefully do quite a bit of social media and create some kind of buzz around it over a series of posting about it for a few days. Of course, sending it out to our e-bulletin. We also want to make sure that each staff member is presenting a presentation like this or a shorter one in a variety of meetings. So these would be systems-facing meetings, but also community-facing meetings, because we want to make sure that everyone who was engaged in this survey, of course, they want to know, they deserve to know the results as well, just as much as anyone, in the system. And I think that related to that, there were about 400 people who participated in the survey. So residents who ticked off a box that said they wanted the survey the final report sent to them. So that we thought that was really important as well, as a group to reach. Other than that, of course, there's reaching all of the VCS groups. We've discussed earlier today how we need to get it translated into at least a summary, translated into easy read, and perhaps some of the more popular local languages within Camden. A large list of system stakeholders taken directly from the previous stakeholders perceptions audit. I mean, just really trying to be as creative as possible, and also looking for opportunities like someone mentioned earlier to get this, even wider and beyond Camden. So, for example, there is an opportunity that the Health Foundation is putting out a call for evidence soon for a big UK-wide report. So, how can we also use this sample size, which was nearly representative, to spread it a little bit wider than our typical reach?
Thanks, Anna. So I think something that's come up already, Robert, you mentioned about getting it to frontline practitioners. I think it's a really good point, and it's something which we probably haven't set out in the plan, and we'll have a look at how we do that, how we get it to those groups. I think it's a really good point. So we'll factor that in. In terms of moving on to talk about the recommendations, I think we've got two options really. The first is I suppose the traditional well-known route of Healthwatch using its statutory power to make recommendations in the report and to have those responded to within I think it's a 20-day window. So that would typically be, that's one of the levers we have to ensure that we get responses to the information we share. The other option is that we provide the system with more time. We give ourselves more time to communicate the findings of the report, and we, I suppose, work a bit more flexibly. And I suppose, so my recommendation is that we would follow the second option. And my reasoning for that is that I think with the COVID pandemic, we really don't know week to week or day to day. There's the situation that the system's facing, what capacity it's got. And I just don't think it would be wise of us at this point to be using our formal power to make recommendations and require a response within a certain time frame. Just doesn't feel quite right to me. I think it may also hamper and limit the impact the report can have, because most of the time these things take there's a gestation period. I think in an organization you get a report, and it's particularly a large hospital, it's to various places and various meetings. So I think there's a good argument for giving the system more time to respond. The other reason I would advocate that option is that this piece of work was very exploratory and very broad, and we set out on that course knowing we were doing so, and knowing we were going to have to put it all together at the end, and not really knowing what we were going to find, and not, I suppose, being able to be as solutions focused as we kind of ordinarily would be. That's not to say we didn't try and find and ask people about solutions to problems, which we did. That's clear from the report. But I think what we've found in trying to draft the recommendations is it's been a real challenge to really know what to tell the system it needs to do. I think that really needs to come through as part of a dialogue with different parts of the system. For example, the findings around information and where people get information. We know that in all groups, television was the most popular medium. Now that poses some really interesting challenges to local communications at the council and at partner organisations, particularly alongside the finding that people didn't seem to really be accessing information from the council or the NHS in that question and that finding. So what is the role for local organisations in making sure that people get that information, and how best can they ensure that messages are not contradictory, for example? So I think it throws up some really interesting and challenging issues, and I'm not sure we want to be being specific about what must come next. Anyway, I throw open to kind of discussion and questions now. And I would add, the not doing formal recommendations doesn't mean we wouldn't have something in the report that talks about next steps or our view on what might need to happen next.
Louise.
Yes, thank you. I think it's a brilliant piece of work, and I think it's very important not to lose the findings. And although we don't know what's going to be happening next, we are at a certain stage now where we do need to consider the health of everybody and not just the people that are going to get the virus. So I think there's three things I thought of. What have other Healthwatches done across London? Has anybody done something similar to this? So is there a synergy where we could put the data together with other data that might have emerged? It might not be the same, but it might have done similar projects. And working with the health champions as well, across at least across our North London boroughs, if nothing else. And then I wondered if we could take it to the mayor's office, because Sadiq Khan is very vocal about what he thinks should be happening to London, and his evidence is slim, I think, for he wants a circuit breaker, and I'm not sure that our evidence would necessarily support that, because just like we were saying, and Paul was pointing out, you know, it's much more far-reaching than just the people that are going to get the virus. And was looking at the presentations this evening, that the press briefing at 5 o'clock, and really it's difficult to see why London is under such tight restrictions when you look at the whole picture. So it's really important that that grassroots information is being fed into the people who are pressuring for different types of restrictions. And I also wondered if we could go to our MPs across the patch, so to Tulip Sadiq and to Keir Starmer, and make sure that they're aware of these grassroots findings as well. I mean, obviously that's not going to change Keir Starmer's position, but I think it's important that this kind of grassroots information does get fed in to the people who are actually making the decisions, because yes, it's very. And also, I wondered, the other thought I had was whether we could, if we could get together with some other Healthwatch from around our locality, if we could get an item on the television on the BBC London News, because they do stuff like that. They do vox pops, and you know, they like these kinds of items, and they're very focused at 10:30 at night now on the personal experience. And I wonder if, you know, especially if we could get the health champions, obviously we've got their support and you've already been working with them. You know, if we can show that we're collaborative, we've got lots of information, it's not just Camden focused, and it's not just Keir Starmer's constituency, you know, that there's a wider issue. I think there'd be real power in doing that, and I think we've got enough depth to our information to support it.
Thanks, Louise. Yes, I completely agree. There are other Healthwatch that have done similar pieces of work, so we will look into that. And I've noted the suggestion about Sadiq Khan MPs, and yes, and the media, BBC London. That's something we did have on the plan, but yeah, we'll add on the political dimension too. Thank you,
John.
I was going to just reinforce that from Louise. I think that's absolutely sensible, and I think, I mean, even if we don't do that, it's just having a press release ready to go, because I can see this. I can absolutely see this catching on somewhere, and basically just being, because the press doesn't wait around, and so if we have a press release and a short piece that we can just literally get out there immediately, if we do get any sort of contact from any of the mainline media, I think would be absolutely very sensible.
These are all really important points. Matthew, I support your decision around not using our statutory powers and delaying and you know, working with the system. More so because I'm quite puzzled about who is making the decision. You know, we talk about the system, but who within the system has the ability to act on our recommendations where it has real impact locally. So that's the first point. We really are having quite a bit of debate around, you know, central versus local, and that's an ongoing conversation, even nationally. So I would absolutely, you know, I do support, you know, you and local within Camden. We know that, you know, our leader and, you know, everyone else is really interested in this conversation and is doing everything that they can, you know, and taking this information. In fact, we were able to share it early, and they've included you in those conversations. And it's important that we you know, we continue to be part of that. But what does strike me is that the time that this report was you know, started, a lot has changed, a lot has happened, a lot is already known. And so what I would urge you is to understand what part of this is now relevant and where do we want to focus our efforts. It's a brilliant bit of work, absolutely, it's an excellent report. But what's relevant, where do we want to now, you know, focus our efforts? And what is it that the public want? What is it that our residents, you know, let's go back to you know, to what matters, which is, you know, our residents, you know, what is it that they're lacking in terms of the information? And something that came across, you know, very, very clearly in this report is the confusion around the guidance, the confusion around, you know, the information. Whether they get it from, you know, television, they're still not trusting it. But where would they go for the right information? And how can we help support that, you know, dissemination of the relevant information so it's trusted and it comes from the right resources? So that would be my suggestion and my comment. You know, there is so much information out there, but what's correct sometimes isn't, and people are relying on WhatsApp groups and their peers, and that may not be the correct information. And we need to make sure that, you know, the correct information gets out to the right groups so they can act on it quickly and safely and keep themselves safe and their peers and their loved ones safe.
Thanks. And just to quickly respond on the which bits are relevant, I think that's a great point. And we need to, I think, find. I think one of the challenges will be that there's so much of it, and little bits of it will be relevant to different people and different groups. And so, you know, we can't write a report for every different group, but what we can do is make it easy for them to access. And I think we need to think through how we do that when we communicate. Now, I mean, I'm going to go on to just mention a couple of particular issues and groups I think come to my mind and screaming out as needing additional work and attention, either by us or somebody else. But we mustn't lose sight of the fact that as an organisation, we'll continue to respond to the issues that are presented to us by, you know, the local community as this pandemic develops. So with that in mind, though, I think certainly what the report says to me is that actually we're at a real risk of health inequalities, you know, being significantly exacerbated. The system wants to improve and to close gaps in inequality, and actually this pandemic is really you know, pushing things the other way. And so specifically, I think you know, the concern that there is within the Asian community about COVID, and concerns in that community about lockdown being eased. I think that's a really striking finding, the difference between that community and others. I think also young people and mental health. Say young people loosely, I mean up to, you know, as we've seen in the report, 18 to 35 really, in terms of the kind of mental health impacts, albeit that was a key issue for, you know, all groups. And then I think another one which was, you know, particularly concerning, and you know, I suppose a reminder, was the reports of feelings of isolation from people with disabilities. So, you know, I think in a future lockdown situation, you know, as we're experiencing now, in a tightening of restrictions, I think we do need to be very mindful of that group and thinking through and you know, or making sure is thinking about that group. You know, not just you know, looking at things for the whole population. Yeah, but I think it's a great challenge, Saloni, and we'll continue to think on yes, the relevance and the fact that things have changed.
Yeah, but also targeting and looking at the messaging that's currently being, you know, sent out. But you know, how is it being interpreted? is there an understanding of that guidance? For example, there was a conversation yesterday in one of the virtual groups around, there's a household with a mother and a child who's disabled. Father is possibly COVID positive. What do households do? How do they isolate? There's no guidance around this. This group of 6, there's just, it's quite vague. And I think we could add real, value to the interpretation, making it a lot more clearer for all communities. John, sorry to keep you waiting. You had a question. We can't hear you.
So I already asked my question. I was just scratching my head.
Okay. All right.
Sorry, just to briefly add, I think the part of this issue is relevance, and I think what you're getting at is that actually there are some findings that are quite obvious and intuitive, and many of our stakeholders will know and recognise the issues. I mean, the mental well-being aspect being kind of chief among those. But there are some things in there that are really not that intuitive, and I think the comments and reflections from trustees bear that out tonight. So I think to sort of answer your question a bit more directly, I think that's probably what we need to focus on, is looking at those areas which are a bit of a surprise.
Yes, absolutely.
I think that would be what would be really useful to take, if we can tease those out effectively and be sure of them. Those would be the really useful things to take to the media, really, because we all know what we're supposed to do. But it's the things that we don't know that are the really useful ones, and the impact, the hidden impacts that it's having, even if it's just on young people. It's a much wider thing. I agree about the messaging being very important, but I also think that what do I mean to say? I mean that it's difficult in individual circumstances to know how to interpret the messaging. I understand that, but the message actually is very simple. That the virus passes from person to person by people getting too close, and that if that was that is the basic message, and that is the thing that people need to understand. And the more people that understand that and adapt their behaviour in everything they do, as best they can within the confines of whatever their life is throwing at them, if they do that, then we won't, all these more extreme measures become less and less necessary. So I think that's the challenge, really, to avoid all those difficult things that are coming up that we didn't know about, by addressing by addressing the message more simply as to what people have to do, and not punishing people for not doing it, but helping people to understand why they're doing it, why it's necessary, and why it protects everybody if everybody behaves in that kind of way. And that cuts right across all communities. And obviously that's harder to do in some communities than others, but it's still a basic message.
Yeah. And also, Matthew, the really good point, Louise. There's something here that's really relatable and human, and I keep going on about using social media in the right way, to connect to more people, and to amplify, where there may be concerns, is that there are powerful testimonies and powerful stories here. And I know there's another charity that I was a trustee of that used those stories and lived experiences and were able to put it on social media. And what it generated was, even a further recognition and saying, yes, I've gone through this, and then another shared experience. And so use the experiences you have here, use the stories that you have here, and make them public so that, people don't feel that they're isolated. People feel that they can connect to this. People are able to more willing to share and come forward to Healthwatch. Would be a suggestion of mine too.
Have people given permission for their stories to be shared?
Yes, and part of the communications plan, just Anna, I'll say so we're going to be using the personal stories in the way that Salone's described, and there is permission, so we'll be using them over the course of the next few weeks, posting one each week is the plan at the moment, and then linking to the survey and seeking to get more views.
But they are anonymized, aren't they, already? The names are not the real names.
Yes, the names are changed.
Okay.
I would like to take this opportunity to open up to the public. Are there any members, you know, of the public that would like to ask any questions related to any agenda items, or even to, you know, if you have any questions, you know, on the report? Yes. No? Okay.
Everyone's on mute, so I'm assuming everyone knows that, but maybe in case you're trying to talk and can't, you'll need to take yourself off mute.
If you would like a copy of the report, please, you know, do get in touch. We'd be very happy to share it. You have our details, of course. And if you feel that any one of your networks could really benefit from, you know, receiving this report, you know, please do get in touch. Yeah. Or if you have any suggestions around the recommendations or any part of this conversation, please, you know, do get in touch. Yeah. Okay, so we'll move on to the succession planning. Is that where we are now? Okay, so this actually is, I think, no, I have one more meeting in public, but this is yes, but this is my last board meeting that I'm chairing. And I just wanted to say thank you for this incredible opportunity. And I will be stepping down by December 1st. It seems far away, but I know how quickly it'll come round. I wanted to say and welcome Louise Jones, who will be stepping in and taking over as chair. Thank you so much, Louise. Before I introduce Louise, I wanted to say a very special thanks to Robert, you know, for all your support and the entire board. Robert is the vice chair and will stay on as vice chair, but really I could not have managed these last 4 years without you, Robert, and really I'm so grateful for, you know, for your support throughout. But Louise, thank you for stepping in and joining, and your contribution in this last year has been, you know, really awesome and appreciated. Louise Jones is a medical doctor. She's led an academic team at UCL and funded by a national charity, Marie Curie, and studied the end of life for all age groups and for different conditions. Your interests are also in qualitative and quantitative methods, and you have numerous publications which include discussions on health and social care, the economics of care, and you're very interested in people with lived experience, and you know, with various illnesses and life-threatening conditions. Louise is a Camden resident and has been part of Camden for over 35 years. And, you know, we are really lucky to have you as part of our board. And we are absolutely in the right hands for you to take, you know, over and for us to, you know, move forward. So thank you, Louise.
Thank you, Saloni. Thank you.
We are already going through the handover process. And, you know, I welcome your feedback, and it's been great already. Yeah, so, yeah.
Thanks very much. You have very big shoes to fill, Saloni, and I'm sure I shall learn loads as I go along, and I shall rely on my colleagues and the public to help me learn. So thank you very much.
Just one sentence. So there's obviously a coffee and a cake somewhere down the line. Saloni, you have led Healthwatch through some very difficult times in the last 3 years. It's been a privilege and a pleasure to work with you.
Thank you.
I
will be sending as part of the succession, I will be sending a letter to the board and of course, you know, to all our partners. But this was on the item and we needed to make it official. We have had numerous conversations around this, but this is now official, that, you know, Louise is taking over as chair. So
we're going to have a leaving do. So we'll be in touch with a date. And I just want to say, Saloni, personally, thank you so much for your support over the last year, yes, bringing me into Camden, and it's been a real pleasure working with you. You are full of energy and ideas and an inspiration. And for somebody so busy, the commitment that you've given to Healthwatch Camden in the time that I've been here, and I know before, it's just been incredible. So yeah, thank you very much.
Thank you, Matthew. Thank you for your kind words. Thank you. I'm not going to say goodbye. There's still some time for that. So I'm not gonna, I haven't prepared anything. So we won't say goodbye just yet, but thank you for that. So on that note, I just wanted to ask if anyone else had any other business, anything they would, or any questions that they have. No? Okay. So our meeting in public has come to an end. If the board would like to stay on for another 5 minutes, we'd appreciate